Okay, so today we'll be talking about I'll give you details about the DRC process, and I will shed some light on the ERC processes as well. So let me share my presentation with you. Okay, so Department Review Committee approvals, how and when. So first of all, so when we talk about AKU, and AKU, each and every department, they have their own department research review committee. And I'm in Department of Surgery and leading the DRC surgery currently. So it's very imperative to have the department review committee. Reason being is that the DRC actually is responsible to review and to evaluate all the research proposals within the specific department in an academic institute. And, so before we go towards ERC, that is the institution, review committee, it is important that at departmental level, all the proposals, they are screened properly. And, the scientific content is screened properly. When you talk about ethics, the ethics content is screened properly. Because at the end of the day, the ERC is basically responsible to look at the ethics of the research. So what they expect is that before the proposals are coming to the institutional ethics review committee, the proposals, they should be scientifically sound. And, so what we believe is that if a study, a protocol, or proposal is not scientifically sound, that means it is not, there are ethical concerns as well. So, both these things are actually correlated to one another. So, so when we talk about research proposal evaluation, the committee is basically responsible to assess the research proposals that are, submitted by faculties, by residents, by fellows, by researchers, by students within the department. And we're looking at the quality, the feasibility, the ethical consideration, and of course, the potential impact of the protocol. And then keeping in mind that ethics is the most important whenever you are conducting a research study. So, assurance, they should, the DRC, it assures or ensures that all the research is conducted with, it follows the ethics standards and regulation, which is, of course, a crucial part of this committee as well as the ERC. So when you talk about DRC, basically, if I talk about DRC surgery, it provides support for screening of research proposals. Basically, as you know, that there are a few components in a research proposal that have to be there. That is it is mandatory that they have to be there in a protocol. So we look at the titles, we look at the introduction, we look at the objectives of the study. Most importantly, we also ensure that the study has not been conducted by anyone else, right? Because we have a record of all these studies. So we ensure that the study is a new study and it has not been conducted by anyone else. Because if this thing is identified later in ERC, then, all the time and all the effort that was made by the investigator is wasted, right? Then, of course, looking at the hypothesis, the research questions, which is, again, a very imperative part of a research proposal. We look into that, and then comes the methodology. So in methodology, that there are different domains that, are mandatory for the methodology section. That is, we look at whether the study design, it is consistent with the study title. The sample size, again, is it appropriately, calculated as per the objectives and the title of the study? And the eligibility criteria of the patients or the participants, is it fine or not? Then comes the data collection tools. So data collection tools are, again, very important part of your proposal. And especially nowadays, I work a lot on mental health among surgical oncology patients. So, there are a number of tools that are available for assessing different outcomes, right? So looking into those tools, whether the tools are validated or not, And if they are not validated, and if they are, I mean, if the investigator is, confused about the tool, so, the DRC committee is there to help them and to facilitate them in advising the tools that can be used, because there are a few tools that are very widely used, validated tools in Urdu language, because since the trend has become, there's a trend of using validated tools. So now a lot of validation studies are being conducted, and there are a number of validated Urdu tools that are available. And if in case it is not available, so we facilitate the investigators how to go about validation and how to write it down in a proposal. Then, of course, come the ethical considerations. So there are many things that are ethical considerations, especially, when we talk about observational studies, so people have this concept that if it's an observational study, we do not need to talk about, how you're going to cater the patient once your study is completed. I mean, if you're looking at a certain outcome, and, the concept is that if it's an observation study, we are just observing. We do not need to do any intervention. Well, that's true. You do not need to do any intervention. But, if there's some outcome that you're looking at least, referrals or some sort of facilitation should be given to the patient. So that is one thing that DRC as well as ERC, they really take into account. That study should not be just for the sake of study by the investigator, but it has some benefit to the patients as well. And then when you talk about ethical considerations, so a very important part of ethical considerations is the consent. That is the consent, what the consent has been taken from the patient or not, and will be taken from the patient or not, and the consent forms. So now we are lucky enough that, and I'll show you the different forms that are now available at AKU website of ERC. So there are templates that are available for the consent forms. So what is expected from all of you is that you should follow the same format as it is, on the website of ERC AKU. And so these forms actually, luckily, are both in English and as well as in Urdu. So which has made, the life of an investigator a lot easier. So keeping in mind that our patient population is majorly, they have problems in understanding English. So we do expect that, the consent forms are properly translated. And in whatever language your population speaks in. So if you're going to a population which speaks Sindhi, you need to translate your consent forms into Sindhi or any other language, right? And then when we talk about, then comes the data analysis plan. Again, that's a very important part of your proposal. It has to be consistent with your objectives, with your variables of interest that you'll be using, with your sample size estimation as well. Because see, at the end of the day, it's very important that if suppose your outcome is a quantitative outcome, so that should be consistent throughout, be it in your sample size estimation, be it in your hypothesis, your hypothesis that you are laying out, the research questions, and of course, your plan of analysis. So these are some of the very important aspects that needs to be there in your proposal, right? Now, how does DRC function? So this is a DRC checklist, and these are the steps that have to be followed by the investigator, or this checklist has to be fulfilled before submitting your proposals to DRC, right? So first of all, the first important thing is that you need to have a research question. You need to start, working on your protocol. And there are a few checklists that are available as per the study design that also I'll show you. So always, before you start writing a proposal, do have the checklist with yourself. So you must have heard about checklists like stroke checklist for observational studies, consort checklist for, RCTs. There are different, Prisma is there for systematic reviews. So there are a lot of checklists that are available for different types of studies design. So that's very important that, those checklists should be available and you should follow those checklists. However, again, we are very lucky that the ERC has again formulated, and there are templates that are given for different study designs. So there are protocols, templates that are available on the AKU ERC website, and I will share that website with you. So you will get all the consent forms, the assent forms, their templates in English and Urdu. You will even get the samples of different protocols as per the study design. Like there's a different protocol template for cross-sectional study, for case control, for cohort studies, for randomized control trials. So so that you are following, that what your protocol should comprise of, what are the the headings and the subheadings that should be there, and the information that is required for in your protocol, right? So once you have, so maybe if I can go to that website and I can show you, just give me 1 second. I'll just open that website and show you where the templates are actually present. Just give me 1 second. And please do make the most of these templates, because life has become really easy with these templates. Okay, so I'll just share my screen. Okay, so this is this website, and this is this ethics review committee, the Aachen University. And over here, you can see everything is present. You have the guidelines, that is the SOP, exemption guidelines, the ERC user handbook. So I'll let you know what is exemption and what is ERC approval, right? So can you see these templates are there? So we are very lucky now. We have all the templates that are available to us, be it verbal consent forms, be it written consent forms, be it the parental consent forms. So so I hope you guys know when to use verbal consent. If the interview is by telephone, you do not need a proper informed consent. In fact, verbal consent should suffice, right? You do not need a written consent form. And if your study population is a child, then in that case you would need parental consent form. So parental consent form both in English and Urdu are available, and along with that the assent forms are also there for different ages. There are different types of assent forms. Of course, the younger the child is, the easier the languages of the assent form as compared to a child who is 13 years old when compared to a 7-year-old child. There is a difference in their understanding. Then there are consent forms for case reports also. And when we talk about the different study design, as I mentioned to you earlier, so there are different templates. There are templates that are given for all the types of study design. So you can see over here, there's a case control study protocol, then there's a clinical trial protocol, then cohort study protocol. So if you go to these, you will be able to write a very good proposal with all the important content that is required for a protocol. And so maybe if I can just open one of them and I can show it to you. And just give me 1 minute, it's just opening. That it is open. Okay. Okay, so I hope you can see this. So this is a template for the cohort study protocol. And as you can see, there's a title, and they have given description that what do you exactly need in the title. Then comes introduction. They've written everything what is required in the introduction section. Then comes the objectives, the hypothesis. And when you come to methods, the study design, the participants, the study setting, variables of interest, the data sources and measurement, measures of biases, sample size, statistical methods, and then comes the references. So see, if you follow these, these guidelines as per or you follow these template, you will have a very good, proposal. So, so this was a website that, you avail this as much as you can and try to follow the templates that, I've showed you. So once you make the protocol, so now what is expected? And so you make a protocol, ensure to have a plagiarism report for it. Like, so as a requirement of DRC, we do expect that you do submit this plagiarism report. And again, the purpose is this will be actually sort of your learning and practice before submitting your manuscript, that how to run a plagiarism report. So we exactly want to say that that in the introduction section, the methodology, there's no plagiarism, right? And as per HEC policy, the plagiarism should be less than 19%, right? So there is this there's this Turnitin help .pk at aqu.edu. This is the email where you can send your protocol, and do mention that please exclude the bibliography. So, in a day or two, they usually send you back your plagiarism report. However, nowadays there have been delays that have been there with the Turnitin help desk. So in that case, for the time being, we are allowing, DRC submissions without the plagiarism report. Otherwise, this has always been mandatory, right? Then, I was talking about the checklist. So, you can follow these templates. That will be good, the ones that I mentioned. But again, as a part of DRC, we do expect that, these checklists as per your study designs, they are followed. So I will again show you, a few checklists. So you can follow this particular link, and over here, all the types of checklists are available, right? So I would want to share with you the different checklists that we have. So I'll share just one of them with you. It's stroke checklist, and it's for all the type of observational study. So we do expect that you follow this checklist, right? So this is a stroke checklist, and this checklist, it covers all the observational studies, right? So what we expect while that when you're submitting your proposal, you do submit this checklist as well as per your study design. So if it's a cohort study, case control, cross-section, you can use this checklist. And as you can, and what we expect is that, you should just, give the numbers, the page numbers as per the items, right? So for the title and abstract, give the page number over here so that, it's easier for the reviewer to be able to see that, on which page is, which item is present of the protocol. Then we go to the introduction. Then we go to the methodology, similar things that I mentioned as per the template of the different protocols, or these as per the study designs. So this section, results section, because of course, at the end of the day, these checklists, they are basically for manuscripts, right? So, when we're talking about a protocol, we do not expect this section to be there. You can always mention non-applicable over here. And in the discussion section, what we do expect that you do mention the limitations, the anticipated limitations. Of course, once you conduct the study, then you'll be able to make out exactly what were the limitations, but still there are some anticipated limitation that you do have in mind, right? So do mention the limitations of your study and the generalizability. That is, how will you be able to generalize your study results on maybe general population, or if not general population, on which group of people you'll be able to generalize your study results, right? So this is the checklist that we do. It's mandatory to be submitted to DRC along with your protocol, right? So now comes the next. So now you have developed all these things. Your protocol is there, your plagiarism report is there, the checklist you follow is there. The important thing is, before everything else, you should know that whether your study is an exemption study or approval study. Now, what is the difference between exemption and approval? So there is ERC exemption or ERC approval. So the difference in both these types of study is that if suppose you are conducting a study in which you have no interaction with the patient, right? You are either taking the data from records, that is the medical records, going retrospectively. We have the HIMSS department, collecting data from there, or you are, the study is being conducted prospectively, but you are still taking data from the patient, and there's no new information that is required from the patient as per your study, right? So in that case also we can go for an exemption. But if you have even a single interaction with the patient, like if suppose there's some information you need from the patient via telephone, then in that case, for your study, that study will not be appropriate for exemption or eligible for exemption, and you will need to go towards approval, right? So if your study is an exemption study, keeping in mind that there's no interaction with the patient, there's nothing new that you're doing, nothing new that you need to ask the patient, and everything is present in the records, be it you're collecting the information retrospectively from the files, from the HIMSS data, from the system, or you are prospectively collecting the data, especially this is for residents, because your dissertation is usually prospective. But in that case also, if you do not have any interaction with the patient and you are just collecting information, or the information that is already available as per the treatment or as per the diagnosis, so you do not need to, and you do not have a single interaction with patients, so that again is eligible for exemption, right? So the things that are required for exemption are protocol. You do not need any consent forms. You need a questionnaire, or the whatever the questionnaire is, in which you'll be taking or jotting down the information that is required as per your study, the variables that will be required in English, and that's about it, right? So it's a protocol. For ERC, protocol is required, and a questionnaire that is in English is sufficient. You do not need any consent forms, right? A plagiarism report will be required for DRC, and again a checklist will be required for DRC. So these are the 4 things that would be required for an exemption study, right? But when we go to approval studies, what happens in approval studies? In approval study means that you have interaction with patient, right? You are taking information from the patient, or you're taking some new information from the patient. In that case, you will require a consent form, right? Consent form will be required. I mean, depending on your study population, if it's adult patients, then informed consent in English and Urdu, or whatever language your population has. Then in that case, you will take a verbal consent, but that study will also fall in approval study, right? And all the consent forms have to be in English as well as Urdu. And then when you come to the questionnaires, and you come to different tools that we are using for assessing the patient's information, or taking in patient's information, that again has to be in English as well as in Urdu. But sometimes there's some information that you might not need to ask the patient, and you can get it from the file. Like if I talk about tumor related factors, if you're talking about the tumor grade, the tumor size, and the histopathology. So maybe if you're getting that information from files, you can keep it in English, but do explicitly mention that this information with their monthly income. If that information it has to be taken from the patient, then that has to be translated, right? So this is the site that I was mentioning, and I have given the link for it, where you will get all the templates for the consent forms and for the different protocols. So these were the checklists, and this preparation is needed before submitting your study for DRC approval, right? So this checklist has to be completed, right? So now what is the submission process? Now, once you have completed your DRC checklist, now what to do next? The next thing is that you need to email all the required, documents, that is your protocol, your questionnaires, your, the checklist, your consent forms, your tools. Everything has to be emailed to the senior research assistant of the department. And first he will screen to ensure that all the things are available, and then and if it's screened and everything is okay, then the process will start. Otherwise, if there's anything that's lacking, any document that is required, the senior research assistant will email you and will let you know to kindly submit that particular document, right? So once that's done, then the proposal is sent to the DRC chair, who then assigns your proposal to two reviewers. So one reviewer is a subject expert depending on your subject. So if it's cardiothoracic, it will go to a cardiothoracic surgeon. If it's it's related to neurosurgery, it will go to a neurosurgeon, etc. And the second reviewer is a research faculty, because the subject expert will be able to tell the investigator or review it subject wise, but the research faculty will be looking at the different aspects of the proposal, right? Once it's there with the reviewers, there is a reviewer. There's a reviewer's checklist as well, and I will show you that checklist too, just for your understanding that what the checklist is all about. So this is the reviewer's checklist. And, the reviewer is going to, look at each and every aspect of your proposal, from starting from introduction to methodology, and then, any ethical issues are there. They're going to look at that. And then they are going to give their comments to, if they feel that it is appropriate, they're going to mark yes. However, if not appropriate, they will briefly describe the reasons for not being appropriate, so that, the investigator can make amendments, right? And then, of course, at the end, that, if they do check all the forms, if they're available or not, depending on the status of your ERC, that is whether it is exemption or approval. And then they do rate how original was the research, and then give recommendation whether there are no revisions required, which is not usually the case. Revisions are, of course, there. Every eye is looking at the proposal, differently. And then there might be some minor revision, major revisions, or rejection. It's very rare. If we feel that there is some major conflict of interest, or the proposal has been copied of some other person, or if maybe the reviewer they are able to, because we are sending it to subject experts, and if they come across any proposal that has been already conducted, and there's some major ethical issues, then rejections might be there, but usually they're major revisions, right? So this is filled in by them, and then the next step is the reviewers take at least 5 to 7 days to review. That's the time period we give them to review a proposal, right? So once we get the reviewers' comments, so these reviewers' comments are not only on this checklist. Especially if I talk about the research faculties, they do ensure to make track changes within your document. And in fact, there are times when we are even it's not only giving comments. In fact, we are incorporating our own comments within your proposals as well. Once the revisions are submitted by the reviewer to the senior research assistant, they are sent to the investigator by the senior research assistant for revisions, right? And the sooner the investigators do the revision, the sooner they will get the DRC approval, right? So once the revisions are done by the investigators, they submit it to the senior research assistant, and then for final review, it is sent to the DRC chair. Now, the DRC chair takes about 3 to 5 days to review and to give the decision, right? Now, if there are minor comments, right, those comments that the chair knows can be sorted out by the investigator, they usually, I usually, just give comments, and then I do inform the investigator that there are some minor comments and that are needed to be addressed before submitting to ERC. But it can be submitted to ERC after the amendments without resubmitting it to DRC. However, if there are any major comments that we feel cannot be addressed by the investigator, what we do is that we do send major comments, and we do expect that they make revisions and they resubmit. However, there are times when it is difficult for the investigator to address those comments. So we have research clinics that the research faculties are conducting throughout the week. And you come by appointment and we help you addressing those comments. So once that's done, then you resubmit it back to the DRC, to the research assistant, who is going to send it back to the DRC chair, and then you get an approval from there for the ERC submission. So once your study is approved by DRC, it means now your study is good to go for ERC submission, right? So now the work of DRC finishes here, and we have reviewed it as the scientific content as well as the ethics. And once we are satisfied with this, we give an approval, and the investigator is good to go for ERC approval. So now, again, the good thing is that now ERC is all on it's all on a software. So, this is this ethics review manager software, which is known as Infonetica, Intuitive Software Solutions. So there you have to go and register yourself and start your submission. So I'll give you, so there's this document that the ERC does have, where helping the investigators to submit their proposal. And it's actually a very good manual in which there is step, each and every step is there to help you in submission of your proposals. So I'll share that with you right now so that you can have a quick look at it. And this is, again, it's available, and if needed be, I can always share it with you afterwards. So this is the Ethics Review Committee manual, training manual for the applicant. So the first thing, if this is the first time you are submitting your proposals to ERC, you need to, of course, create your login account and login. So this is the site, as mentioned over here. This is the ERC site, or the Infonetica site, where you will create your login account and login, right? So once you're going to click on this, you'll get this window. And over here, this is the research ethics application and login, where you will create, if you're a new user, of course, you're going to, create your login. If not, then simply you will just enter your email address and you will enter your password. Now, if it's a new submission, so over here, you can see that there is this option. So once you have entered, this window will open, right? And so this is the work area, which basically shows you the different notifications if you have gotten from ERC, or if there are any signatures that are pending or need to be done. If there are any transfers, like, especially when I talk about residents, there are times when you are submitting the proposal on behalf of the PI. So in that case, always ensure that you do transfer, you do share the project. This is very important, because once the residents are done with their, with their training and they leave, if they have not shared the proposal not shared the proposal, I hope you can all see me. Okay, if they have not shared the proposal, what the problem comes is that once they leave, then their emails and everything is shut. So then it's a big problem for the PIs, right? So it's very important that always share the protocols with your PIs, right? So you click on this create project, right? Once you have done that, then you enter the project title, right? And you have entered your project title here. Then you complete your application, right? So there comes the application for ERC approval. And you can see that there's contact information, agreements, and signatures. So you click on this. This is the first question that is there on your ERC form, right? You're going to click on this, and then you keep on doing, once you keep on filling, so there's the title of the study. So majorly the things are actually copying things from your proposal to this application. So these things are very similar to what is present in your proposal, right? So you enter the title of the study, then you enter all the information about the principal investigator, about the co-investigators in the ERC form. And then a very important thing is that before you submit your ERC, you must have come across this, CT or the GCP. So let me just open that site again for you. And so these again are present within the ERC website. And you need to complete these. So these are actually, you can say these are ethics training, certificates, right? So they're different, there are different types, and you can actually utilize any of them. So there is the CT program, in which there's this biomedical research basic course. So this is, these are some modules which you need to read, and then there's a quiz that you need to attempt. And then once that's done, you get a certificate, and that needs to be submitted to ERC. So this is a requirement of ERC, right? So there are different type of CT courses. Modules. Then there's this one, good clinical practice also. So this is actually freely available. So anyone who is not from AKU, you can easily, so these few are actually, eligible for only AKU staff, right? But this one, when you talk about good clinical practice, this is available. This is free of cost, right? So you can, this is also very commonly used, right? So you can use this. And this one, if I talk about this one, this is only applicable for co-investigators. So if you are the PI of the study, you cannot, this will not be, not be sufficient for you, right? So yes, this is the document of ERC. Just hang on. So it is extremely important that once you are, you have done your ERC, that's fine. You have submitted your study, but this doesn't mean that you're done with your ERC. So DRC will not be a major issue. Reason being is that DRC, once they have given the approval, that's good enough. But what is needed, that if you're upgrading anything, one thing is that if you're changing your title majorly at the time when you're submitting for ERC, please do inform DRC about it. So because we have it, so that we have it in our record. But when we talk about ERC, if you plan to do any sort of amendments, once you have submitted, right, your proposal, and even if it's been accepted, and if there are some major amendments that you plan to do, then in that case, there is this option of amendments, right? So just hang on, if I can see it over here, I can show it to you. So you create a subform. So there's this option you can see over here, create a subform in the work area, and over here you will create a subform. So it has different options. So if it is amendment, you will click on amendment, and then you're going to submit the amendments that you have done. If they're major amendments, like if there's a minor amendment, maybe you've added one question or removed a question from your questionnaire, that's not a problem. But if you're planning to change your tool, or you're planning to make major changes in your consent form, especially after testing, pilot testing or pre-testing, sometimes you do feel that there are some major changes that are required, they are supposed to be reported to ERC, right? And then once your study is completed, right, you have completed your study, so there is a closeout report that is there, that again, you will go on the same option, create subform, and you are going to submit the closeout report so that the ERC knows that this study has been completed, right? However, if 1 year has crossed and so you get the ERC approval for 1 year. Once your study is going to the second year and you still need to continue with the study, then you need an extension, right? And you need to submit ERC for that extension, because if you are not going to do that, and if there's that lapse period is there before, once your ERC expires, you didn't take an extension and you still conducted your study, and maybe it was conducted for 2-3 months, you recruited patient, and then you got approval after 3-4 months, the extension, what will happen? Because there are ERC audits that are done, randomly of 10% of studies from every department. You will face a major problem, and that is that they will say that you will have to remove all these patients who were recruited during the lapse period, right? If there's a lapse period that is there between the extension and the approval, you will need to remove those patients. So that will be actually a major loss of your patient. So whenever the time is near, what ERC does is they start sending, right, that your study is about to expire, so please do take and request ERC. However, once your extension or your study is completed, in that case, what you will do is you are just going to send a closeout report to ERC, and they will send you that a letter that your study has been approved, you're completed. What we expect as DRC is that once you get an ERC approval, please do send us the ERC approval letter so that we have it in our record. This is really helpful for us as DRC to have a complete record of your ERC status. So that is what is expected by us from you, that once your ERC is approved, you please do send us the letter so that we have that in our record. So this is the annual report I was talking about. If your study is completed or not completed, you will have to, as per, whatever your status is, you will need to submit these to ERC.